All right, so we're joined by Dr. Jianwen Crump, professor of speech pathology at the Mississippi University for Women. We thank you so much for joining us virtually today. We have a class online with us from Velma Jackson High School. We're recording this for all of our friends in Madison County Schools, Rosa Scott, Madison Central, Ridgeland High School, Germantown High School, the Academic Options Center, and our YouTube channel. And we're in the Human Services Career Cluster. And I know speech pathology, while it is kind of falls under the health science, it also falls under the human services as well because it is such a unique career in the way it really works one-on-one with people and the different type of settings that speech pathologists work in. So we thank you so much for taking some time for us today.
Most certainly. I'm glad to be here.
All right, so before we get into what all it is you've done and you do, you went to the Mississippi University for Women. You
Yes.
went to Louisiana Tech and you went to William Carey. So take us through your college background, and kind of your transition from one school to the next.
Okay. Um, so I originally, while at St. Andrews and Jim Hill High School, I knew that I loved science and I knew that I loved English, but I didn't really like math. And so I was like, what can I do that mixes English and math, but doesn't have a whole lot of math? I mean, English and science, but it doesn't have a whole lot of math. And so I kind of did some research. I was like, hey, maybe speech pathology. And so I started looking for different schools. I only knew one or two speech pathologists. And I started just kind of Googling, hey, what careers are in high demand? What's going to be in high demand in the next several years? And so I saw speech there and I was like, okay. And so I looked up different schools that had the major. And I knew that I kind of wanted to stay in the South, Mississippi, Georgia, North Carolina ish. And so I went and toured, did some of that, and ended up finding that the place for me was the W, small but close to Mississippi State, because I knew that I needed a small class and not a really big class.
Yeah.
So I chose the W, and majored there, stayed there 4 years. Um, I got a minor also in marriage and family studies because
Okay.
just in case speech didn't work out, I had something else that I could move toward.
Yeah.
And ended up going into graduate school at Louisiana Tech. Speech path is a very competitive field, and so I was like, wherever I get in first, that's where I'm going. And so I went to Louisiana Tech in Ruston. Had a wonderful time there, very close to Grambling. So I was like, hey, if I ever want to do HBCU football, I'm just down the street. And so finished there in 2 years. And then I started working in the school. And I said, and that was as a speech pathologist. And I said, hey, I think I want to do more. I love students. I love teaching other students. What can I do? And so I furthered my education in educational leadership, so that I would be able to teach speech path at some point. And so ultimately worked for about 9.5 years and then transitioned into teaching back at the W where I went to college. And so it has been very fun. I love learning. So going to school is one of those things that I could forever do. But that's been my experience with different colleges.
Yeah, now and before we get into what speech paths do, I do want to hit on the W because I know you're a professor there. And honestly, I don't think it's said enough what a great place the W is. We have the current Miss MUW as a Velma Jackson alum. We have several Velma Jackson alums at the W. We have a few teachers that are W alums. And I say this all the time, and people think I'm joking. I have never met a single alum of the W, male, female, black, white, whatever, that has not said they had an incredible experience.
I completely agree. It is the perfect little home away from home. For everyone that is like, hey, I think I want to do sororities, fraternities, they have those. That was one thing that did draw me there was they had this the sorority that I was interested in. Campus life, extremely fun. And it was a great way for me to get involved but not get lost because sometimes at really large schools, it's easy to just be a student number, your student number 00669999. Where at the W, I could go to my friends and so I chose the W for that reason. I also, just being really picky, I wanted a private bathroom, and so all of their dorms allow for private bathrooms. And so I was like, I need to go there. This is crazy.
Well, the quality of the dorm is important. I mean, I mean, you say you're being picky with it, but that's a big deal. You know, having a comfortable place to live when you're on campus is a very big deal.
It is. And another thing that really drew me there and still draws people there, it is still one of the universities that has the lowest tuition rate. And I knew that I didn't want to leave college with a whole lot of debt. So I did choose that for that reason too.
Yeah, and the W also might, and all of them do a great job. I'm not down in any other universities, but the W, just from what I've seen in my role now, might be the most transfer friendly university in the state, especially when it comes from kids going to community college first. They really want to get those community college students so they can finish at the W. So, I'm a huge fan of what the W does, and I think it's important to tell, because a lot of people don't know this either. Just because it has the history of University for Women, anyone is allowed to apply there. So it don't be if you're a male,
Yes.
don't be lured away from applying there because it is called University for Women. It is literally for everybody. So big fan of the W, and I know that's where you teach now.
Yes, sir.
All right, so
Thank you.
we watched a few videos on speech pathologists before you came on, and I think they did a good job of showing speech pathology. It, like we said, it is a health science type field, but it also really is a field that needs people that are good with people. I know that sounds silly, but that's really what it needs because it's a lot of one-on-one work. You have to work with the families, and you have to work with like you see. Mental health counselors all the time talk about techniques, coping techniques. Speech pathologists have speech techniques that they have their clients practice. So it really is a way to build. You see that build of improvement with your clients, no matter who they are.
Mhm. Right, right. That is very true. And though it's in the health sciences field for those that say, "Hey, I don't know if I can do hospitals or skilled rehab settings," we also do a lot of health science field work in schools too. So you have an array of jobs that you can do from home health to early intervention, daycares, schools, hospitals, private practice, universities. It's so big that it can range from articulation, individuals that stutter, individuals with dementia, Parkinson's, just so many different fields. Those that have had traumatic brain injuries, I think everyone listening has likely knows someone that has had a stroke. We are constantly working with individuals there, and even we extend to the point of individuals that have strong dialects and or strong accents, and they want to sound less like their native tongue. We work with them to become more intelligible. We're just constantly working with such a wide range where if you decided, hey, I want to do a speech path and I want to do voice for the first 5 years, and then you want to switch over to do trach vent weaning, you can do that for another 5 years. You can do something every couple years and still not touch the entire field.
Yeah, and then also you have a lot of health science people that say, I want to work with the patients, but I don't want to do all the blood and guts and things like that. This is a field where you really wouldn't have to deal with that.
Right, right. I said earlier that I really didn't like math. With speech pathology, you don't have to do a lot of math. You do have to cover your basic college algebra, statistics, chemistry. However, those are all classes that you would have to take anyway. So getting into trigonometry and all of the other stuff that I was not good in, physics, all of that, that is not something that you have to do. So in the event that you are saying, hey, I want to make good, but I don't want to have to deal with cutting people open or giving them shots, this is definitely a field that you want to look into.
Yeah, and that's so great, and I'm glad you mentioned the traumatic brain injury. A good friend of the school district, Alan Loving. I don't know if you're familiar with him. His wife teaches in the JAG zone, had a traumatic spinal injury, and he had speech pathologists work with him while he was at Shepherd Rehab Center in Atlanta, and he talked about what an important role they play. And you talked about the people getting over strokes, the people getting over injuries, the children that are born with developmental issues. There's more and more knowledge of that now than there was 10, 15 years ago. So there's a bigger need for that now than there ever was. And the rewarding aspect of this career has got to be immeasurable as compared to others.
Definitely. I'm glad that you brought that up. I know everyone will likely take some course where you are learning that babies are typically born at 20 plus weeks as the youngest. Well, now they have lowered that age, and some babies are even being born and viable at 24 weeks. That's extremely early. And although it's earlier, they are viable, so they're living, yet they oftentimes need a lot of extra care. And that's where speech pathologists come in to help them learn how to feed properly, how to speak, because their little brains didn't develop in the same time and space. And so that is one of those areas that we are now having to target more. And then individuals are living longer than they did 20 years ago. And so as that population gets older, we're having to deal with more geriatric issues. So you are very, very correct there.
Yeah, and also, and you talked about with the babies born early, a good speech pathologist, and I'm not just a good speech pathologist, any speech pathologist is going to have to not only work with the patient or the client, they're going to have to work with the family as well to explain to them what they need to work on, explain to them here's how you can improve things. So it really is a holistic approach to the whole family that makes it easier for everyone.
Definitely. Early intervention therapists working with parents of children from birth to 3. They are definitely working with those families that have been hit with some developmental issues that their child may have been exposed to, or it could be something that they are completely taken back by. So we are definitely in that area too. So if you say, hey, I really don't want to be a preschool teacher, I want to do a little bit more, then definitely this is a field that you could do that in.
Yeah, and that's the cool thing, and you talked about this. It is very portable. Once you become a speech pathologist, if you get sick of a certain area, there's other areas that you could definitely find your place in, and it's not necessarily a clinical setting. There are, like you said, the schools and the nursing homes and the private practices that always need speech paths.
And even research, we are constantly trying to figure out what better ways we could do things from when speech pathology really came prominent on the scene in the mid 1900s. 1800s. There was research then that has now been said, hey, we don't do that anymore, and that's due to researchers constantly constantly analyzing theories and moving theories to a different level. And so in the event that you decide, hey, I love reading and I love proving theories right or wrong, you can definitely take that route too.
Yeah, and before I get to the students' questions, and they're typing them in now, so we got some good ones that I'm glad they're asking. But I know obviously we're a big fan of the W, but I know Delta State has a great speech pathology program, and I know Jackson State has some really cutting edge technology as far as speech pathology. So there are several places in the state where you could get this and get an undergrad at the W or a master's at Jackson State or vice versa. So there really are a lot of great local schools that are getting more affordable on this program because there's such a need for a good speech pathologist.
Yes, and and I'll say this: Delta State has undergraduate speech, and everywhere else that I'm going to name has both undergraduate and graduate, and that is Mississippi University for women, or the W, Jackson State, Ole Miss, or University of Mississippi, and also the University of Southern Mississippi. So you do have a lot of opportunities. And one thing that I failed to mention is that, let's say you get your degree here, you're able to move that license across the entire nation and even into some Caribbean places.
Wow.
So even if you're bilingual, that is wonderful, because we are constantly pushing for more bilingual therapists as well.
Yeah, and we have several bilingual students in our district. We have several first generation Americans that this is a great field that they could really make a great living in, that they are needed. Because as
Yes.
you know, there are immigrants coming to this country every day. There are several exchange students that might need help in an English speaking language, so English speaking setting. So any of our bilingual students, this is a great field to look into. I couldn't agree more on that.
Yes. And if for all of the bilingual students, if you have questions, please get with Mr. Pyatt. He can get you in contact with me, because we have some great opportunities for you. And a lot of scholarship money is available for that particular interest area.
Yeah, and I know the W is another one, and I know Jackson State does a great job of this as well. They really like to give scholarship opportunities to international students. So if
Yes.
we have international students, really look at these places and find the best place for you. So I'm really glad that this is a field that's really pushing that bilingual education, because it is definitely needed, not just in the U.S. but everywhere. But I do have some
Right.
questions from the students, and these are really good. So I'm glad
Okay.
they're asking these. This first one is Colton Johnson. He's in ninth grade, and he's a big technology guy. And he asked, what type of technology do you work with, and what type of technological advances have you seen in your career?
All right. So, Mr. Colton, wow. Advances, I'll start there. We are constantly advancing the materials that we are using for more virtual interaction, because individuals are needing therapy everywhere. And ever since COVID, we have learned that we don't have to fear virtual anything. And so we are constantly pushing virtual programs that we are building for students that learn better by doing video games. We are constantly advancing PET scans, CAT scans, where we're able to look at different body parts to understand where the brain is activated during certain acts that might not happen after a stroke, or may not happen after a spinal cord injury. So we are constantly advancing in that area. We have even started to do ultrasound with articulation clients, where they are able to see where their tongue or lips or whatever is where there is a deficit. And so when they're able to see that, it's easier for them to correct it. And so that is something that we are starting to do more of. Speech pathologists also they also do hearing screening, and so we are constantly trying to make it easier for those smaller populations, or those, and when I say smaller, meaning younger individuals that don't necessarily respond to I heard that. So finding different materials that are able to help them better understand or even give us those readings without a verbal response is definitely needed. So it is beginning to expand more and more, but it is definitely on the horizon for more.
Yeah, and that's an important point because there could be hearing issues that cause speech issues. And I think a lot of people don't understand that,
Yeah.
and the technological advances are showing that there's ways around that. And now hearing impaired people are able to communicate better, better and better every day. So that's a huge technological advance that keeps coming.
And one more thing, Colton, speech pathologists also work with individuals that have AAC devices, alternative or augmentative communication devices. So those individuals that may use eye gaze to type out what they are saying, or maybe they are using a button. So we are constantly trying to advance that to make machines smaller and more compact. So we are definitely needing great minds like you to help us do that.
Yeah, and he definitely is one. This is Christian McGee. He's also a ninth grade member of our football team and our state championship powerlifting team. And he asked, is it hard working with so many different types of people with different personalities?
You know, I'm a people person, so working with people and different types of personalities is my strong suit. Now, for individuals that don't necessarily like to engage much, it is still areas that you can fit. With anyone that is challenging or is less nice than someone else, it can be difficult. But I like to always think of it as we are here for a job and we are here to serve our clients. And so I like to keep that at the forefront of why am I here? And as long as I'm able to keep my why in the front, I'm typically able to deal with everyone.
That's awesome. And I don't care what field you go into, and I know that they get sick of me saying this. If you can learn to work with people and learn to talk and learn to present yourself, whether you're a speech path or whether you're a auto mechanic, that's going to take you very far in any career. That's going to set you apart. So that is a skill everybody needs to learn.
Yes, communication. Yes.
All right, I just got one more. This is Caden Williams. He's in ninth grade, also a member of our football team and state championship powerlifting team. And he asked, uh, did you ever see something gross when you thought you wouldn't? And did that make you want to change your career choice?
So I have seen gross, very gross things. And I'll give you two examples. When we are doing hearing screening, sometimes if you're working with audiologists, you do have to look in the ear to look at the ear, look at the eardrum, ear canal, so forth. And sometimes your ears are not always clean, and you don't know that because your finger can only go so far.
That's a good point.
And if you're not using an otoscope, you really can't see what's really down there. And so that was tough looking at some of that because it can range from earwax to objects to animals to very different things. And so that did not make me want to change my career, but it did make me very skeptical about looking in ears. And then when working with trach patients, oftentimes you do get a lot of secretions around the trachs. And so having to use very surface level suctioning, sometimes that can be a lot. especially when you start adding additional colors and so forth to the secretions. It didn't make me want to change, but I did have to grow to understand that these individuals are healing and this is a part of their healing process.
Yeah, because I guarantee they aren't exactly enjoying what they're going through. But the funny thing is, and I'm not making light of trait patients, but the funny thing is, every nurse and pretty much everybody that's worked with any type of patient care of any sort has always said that is the number one grossest thing they've ever had to deal with.
Yeah, blood isn't even a big thing because, yeah, but all those secretions, yeah.
Well, we're almost out of time, and we thank you so much for fitting this in your schedule. But before we go, obviously we talked about all the different advances and skills that are needed in this field. So why should these kids that are in ninth grade really consider getting into this great field that needs good people?
Number one reason we need you. You are already doing one thing that all of us do, and you are desiring to learn, and you are setting out, taking time to learn. And individuals that are self-driven, we need them. And so, one thing that I didn't touch on that almost everyone asks, and you need to know this: the pay. Everyone wants a good paying job. I can be honest with you, in the field of speech language pathology or audiology, it is a well paying job. Please Google it, whether it's from schools to researchers to hospitals, program designers, technology designers. It is a wonderful field, and it pays very, very well. And there is a job waiting for you because we're constantly needing them. So oftentimes you may go into jobs where the market is saturated, not with speech pathology. You will have a job, and you have the capability of moving around for the rest of your life, even with travel therapy. So
Wow.
take a look into it. Know that there is room for you and we need you.
And even right here in Mississippi. So love it. And it's such a great field. And again, we thank you so much for joining us, Dr. Jianwen Crump, Mississippi
Yes.
University for Women, Professor of Speech Pathology. Thank you so much for joining us today.
Thank you. Take care.
All right, talk to you soon, buddy.
All right. Bye bye.